The time is just gone 8:22 a.m. and we kick off this morning looking at COVID-19, looking at the third wave, and experts are warning that South Africa can expect a third wave of the COVID-19 virus by March, by the end of March and early April. We joined on the line this morning by Professor Darelle van Greunen, Director of the Center for Community Technologies at the Nelson Mandela University. Professor van Greunen, good morning to you, sir. Ma'am.
Good morning to you and your listeners.
Well, Prof, let's talk about this third wave because I think it's come sooner than what we expected. We were told initially that we were going to be hit by a third wave towards around May, June. But we see now it's coming as soon as possibly even a week away or early April.
Yes, I think maybe we just need to put it into perspective as well. A lot was said in the modeling, etc., looking at the behavior of the virus and how it played out over time. So based on the bigger picture modeling, the thinking was that it would be a little bit later on in the year. But of course, we know with pandemics, things change a little bit. And also, I think the most important part of this is that human behavior is playing a very prominent role in this. And from the human behavior, we can see that there's a change in how the virus is playing out. And therefore, we think that the likelihood that the third wave will start earlier is very good. We also base this on our modeling that we've been doing for the past year or so, using the local data in the Eastern Cape, the Western Cape, etc. And everything points to it that we can probably expect the onset of the third wave shortly after Easter.
Yes. Now, the question would be, are we able to avoid the third wave? Are we able to take preventative measures?
I wouldn't say we're able to avoid the third wave. That is the nature of a pandemic, that there will be a third wave, more than likely, until we've reached population immunity. But the extent and the intensity of the third wave is most certainly in our hands as the general population. So how we behave, what we do, whether we adhere to specific regulations, etc., that could depend on how harsh the third wave is. And I think we really need to take our lessons from the second wave and make sure that we apply those as we go forward into the third. I see this morning that the National Command Council will be meeting as well to discuss possibly some change in lockdown levels, etc. So it's not only us down in the Eastern Cape that are concerned. There's a bigger concern.
Just looking at the country as a whole and specific areas, are there any hotspots that we need to look out for at this point in time?
At the moment, there are still some of the provinces that are suffering the backlash from the previous wave. So if we look at Gauteng and we look at Mpumalanga previously didn't feature all that much, but their active cases are still very high. We're starting to see a little bit of activity in the Western Cape and then also in the Northern Cape, which of course may well be pointing towards the third wave. So our concern is that this time round, the second wave was led by the Eastern Cape. We anticipate that the third wave will be led by the Western Cape and then spreading into the Eastern Cape. Within the Eastern Cape, of course, our two big metros, Buffalo City, Nelson Mandela Metro, those are of concern. They are where the active population is. And of course, with Easter weekend coming up, we have a lot of movement between provinces. And that could really and truly trigger the third wave significantly.
Well, in fact, this is the point I was going to make because I think when we look at the second wave, it took place around December as well. A lot of movement of people, and with Easter, we find exactly the same. But also, Prof, do you find that people have become a lot more relaxed now, and we are not as serious as we were initially regarding this pandemic and our behavior towards this pandemic?
Yes, I think that's a very, very true statement. And as much as people may not, they still adhere to wearing masks in shops and so forth. I think there's a general relaxation about how we behave and what we do. About 2, 3 weeks ago, we had a major heat wave in the Eastern Cape, and people flocked down to the beaches in their thousands. And of course, there was no social distancing, no mask wearing, no nothing. But also going into shopping malls, etc., there's no longer the point where people check, are you being sanitized? Are you sanitizing? Restricting the numbers of people that go into malls, into shops, etc. So just a general relaxation about that. And then, of course, the other thing that we have is that people may only have very mild symptoms, or they may be asymptomatic. And because we're not testing as much anymore, or people are not going for tests, they are walking around like a time bomb, just infecting people without even knowing that they themselves are positive. So I think there's also a need to sensitize people to the fact that even if you have very mild symptoms, but they present in any way like a COVID symptom, that you should go and see your healthcare professional and at least just check that you do not have COVID, not only for your own sake, but for everybody else around you.
Prof, do you think somewhat the campaign on the part of the government has mellowed down? And, we are not, focusing a lot in ensuring or sustaining this awareness drive, because I think this is very, very important because, we don't find a lot coming through, but also at the same time, looking at the lessons that we've had from the first wave, from the second wave, in terms of our preparedness for the third wave, because obviously we know the pressure that is placed on hospitals. We're talking about healthcare facilities, we're talking about PPE, we're talking about oxygen, we're talking about ventilators. Do you think that we haven't sustained or maintained that campaign in the intensity as we should be?
I think there has been a change in emphasis of the campaigns because there's also the need to convince people that they need to be vaccinated. So it's a little bit of a diversion of efforts, focusing on vaccines, but also still maintaining the height of awareness about what we should be doing. And in the last sort of 10 days or so in the metro here in Nelson Mandela Bay, there's been a conscious effort, conscious drive out into the community again to make people aware of what they should be doing. But I think on the whole, in the country per se, that campaigning has certainly not been as active as what it ought to have been. In terms of our preparedness for the third wave, I think the healthcare facilities, we certainly have the necessary infrastructure and everything else in place now. Of course, we are possibly getting to the point where people are just so very tired. The healthcare workers are completely burnt out. So the question is not so much whether we will be able to cope with the third wave in terms of the intensity, but will the system hold? Will we be able to maintain that level of intensity that is required in terms of looking after patients and at the same time doing the vaccination drive and still looking after our daily cases? That to me is a big concern, whether the system will hold.
Well, let's just wait and see what happens. But just finally, looking at some of the lessons that we can take from overseas, because we know a number of countries have hit second and third waves, and obviously they have been taking, some of them have been taking certain drastic measures.
Yeah, so I think looking at some of the European countries and so forth, my personal preference would be, and some of my colleagues here as well, that we have a change in lockdown level, and that we do not wait until after Easter weekend, but that we do that before Easter weekend to ensure that we just assist people in how they behave. So change in lockdown level, maybe restricting the number of people that can gather. Easter is a time of religious gatherings, and not out of disrespect to anybody, but just for the safety of people. Let us adhere to that. And even not saying shutting down the economy, but restricting hours of liquor sales, etc., changing the curfew time again, so that we ensure that people stay home. Those are the things that worked previously, and we saw them working, and we could see how the numbers dropped when we implemented those. So the plea at this point in time is, let us not wait until we are right into the third wave. Let's be proactive, preventative, and change these things before we go into the Easter weekend.
Well, Professor Darelle van Greunen, thank you very much for that and for your time with us this morning. We wish you all the best.
Thank you. Much appreciated.
Professor Darelle van Greunen, Director of Center for Community Technologies at the Nelson Mandela University, joining us this morning. We come back. We are taking a look at the geopolitical tensions, and this is surrounding the Grand Ethiopian Renaissance Dam.